Hello, you are watching News 9 Digital's Facebook Live with me, Amrita, and today we will be discussing about a new pathogen which is coming to the fore, threatening the lives of critically ill COVID-19 patients who are admitted to various hospitals. So this is based on a particular study which was conducted in Delhi, wherein 596 COVID-19 patients admitted to the intensive care unit between April and July this year were surveyed, out of which 15 patients, or 2.5% of those surveyed, were found with a fungal infection called Candidemia, which is said to be resistant to drugs. So this particular infection is quite common amongst those who are hospitalized. It lurks around the hospital corridors and in hospital setups basically. But how dangerous is it in this particular pandemic? First of all, to know more about what exactly this infection is, I have with me my colleague Ashish. Ashish, my first question to you is, what exactly is Candidemia infection?
Well, Amrita, now before we start up speaking about this particular infection, it is obviously a known fact that a lot of people who are dying from COVID-19 are not exactly dying because of the coronavirus. They're dying from secondary infections, comorbidities, and a lot of these other things that are coming into the picture once they're hospitalized. And one among those common ones that is being noticed right now is Candidemia. Now, this is basically a very common bloodstream infection that occurs when a person is hospitalized, and this results in the person staying at the hospital for a very long time, and this could possibly result in a lot of other complications that again at the end of the day end up in complicating the person's health and could also result in death. And the fact that this is something that has been alarmingly increasing over the past few weeks is something that the doctors have started noticing, and also there have been a lot of studies that are being done about this. Also, let me speak about the symptoms, just in case anyone wants to know what exactly what are the symptoms that are developed before this bloodstream infection affects them. Well, the common symptoms include fever and chills, which is again pretty similar to COVID-19, so it might be very difficult for anyone to identify or distinguish this particular infection with from COVID-19 in fact. And there are also other infections, other symptoms that come into the picture, such as low blood pressure, fast heart rate, and rapid breathing, and this can cause septic shock and therefore cause further more complications. Now, the problem here that a lot of people are encountering is that this again is the symptoms that we're looking at are again pretty similar to that of COVID-19. So how exactly do you distinguish between a general COVID-19 infection and any sort of a secondary infection? That is a big question mark as of now. And also over the past few days we've been speaking to a lot of experts, and they also have been commenting how diagnosis is solely focused on COVID-19, and most of the reports are solely focused on COVID-19 and do not really highlight the fact that there are a lot of other secondary infections that are also at play. So this is something that needs to be taken into the picture, and Candidemia, like we've been talking about today, is something that has now come into the picture and is raising a lot of alarms, Amrita.
So right there, thank you Ashish for bringing us all of those details about the infection. So out of the 15 patients who were found with this infection, 8 of them died. And it is not yet clearly established whether Candidemia infection was one of the leading causes of death or not, but probably it was one among the many reasons for the death in the critically ill patients due to COVID-19. But how is this infection actually caused? So there was a study which was published in the Indian Journal of Critical Care Medicine, whose title is A Prospective Study of Fungal Colonization and Invasive Fungal Disease in Long-Term Mechanically Ventilated Patients in a Respiratory Intensive Care Unit. So in this particular study, they found out that Candida albicans, which emerged as the most common colonizers of fungal infections, were found in 10% of the patients that they surveyed. So over here it can be while it is not clear as to how the infection comes, it could be due to the mechanical ventilators that are being used, or it could be because of the various sort of equipment that are in use at hospitals, and it can also spread through contact, that is through skin. So there are various possible ways from which this infection can be caused, and among the people who are at the highest risk of developing the invasive infection are those who have been in the intensive care unit for a long period of time, whose immune system is quite weak, or they are going through chemotherapy for cancer, or have recently had some sort of a surgery, especially in the abdominal region, or have diabetes also.